this technology you already use? It's the beginning of your 24/7 health consultant. Hi, I'm Dr. Brian, retired physician and founder of Health Without Risk. Like many of you, I use the health app on my phone, but I also use a Bluetooth connected blood pressure monitor. For the past 5 years, I've used a smart scale to track not only weight, but percent body fat and percent muscle. We've all moved past the ability of tracking just steps and sleep. Today's devices are crossing into serious clinical territory, making do-it-yourself diagnostics a reality for everyone. This is a huge shift in DIY healthcare. For example, patients with atrial fibrillation can now monitor their heart rhythm with a portable FDA-cleared device to perform a DIY electrocardiogram, an EKG, right from their phone. These devices are affordable, often ranging from $79 to $129, but the innovation doesn't stop at your wrist. Researchers are developing wearable patches that can detect tiny vibrations or wheezing sounds to predict an asthma attack or respiratory issue before you even feel it. This tech is brilliant because it's moving from simply tracking symptoms to actually predicting their onset, which is huge for managing chronic diseases like asthma. They're even creating smart mirrors that analyze your face and vital signs. However, there are crucial science-based risks. The biggest one, data privacy. When you generate this much personal health data, you need to be in control of who uses it. And also don't fall into the trap of over-reliance. You still need a clinician to interpret the data, especially when it shows something is off. On the upside, this is dramatically improving access and adherence. One study found that patients using a special home phototherapy device for psoriasis were as successful as those going to the doctor's office, and they used the treatment more consistently. Blex even makes an intense pulse light phototherapy hair removal device that works as well as the machine I used in practice that cost me $135,000 in the 1990s. This Blex home device is $120. This saves time, travel, and indirect costs. The evidence is clear. Getting involved in your own care leads to better outcomes. Devices are powerful tools, but they work best when the data is reviewed by a professional. Don't let your excellent data sit in an app, unused or worse, misinterpret it and cause yourself unnecessary anxiety. If you're using new medical device or advanced tracking and need help translating the thousands of data points into a clear preventative health strategy, Health Without Risk is here for you. Reach out by email through the profile page if you need help. Like and share this video, and don't forget to subscribe to or follow Health Without Risk, where we explore options for better health for do-it-yourself health care. Thanks for watching. Bye.